Hi guys, welcome back to another video of 8.VSR channel. So today we will be continuing about the wound series, that is the veterinary surgery and radiology. So we'll be dealing with the last part, that is the animal bite wounds. So subscribe our channel and hit the bell button for more updates. So moving to the first and most important part, that is the introductory part. So these wounds are actually deep and caused by the penetration of the teeth of the animal. They are actually the special concern because very pathogenic organisms are found in the mouth of the animals. So that will be carried along with the bite. That is the deep into the wound, they will be introducing many bacteria. So they also provide conditions that is suitable for anaerobic bacteria. So main types are snake bite, dog bite, scorpion sting, insect bite, and rat bite. So we'll be dealing with these five things. So the first one is the snake bite. So there are various types of snakes, that is poisonous, non-poisonous, etc. And only a very few of them are poisonous. So the three poisonous varieties commonly seen in India are the cobra, krait, and Russell's viper. So snake venoms are of mainly two types. That is the which will be one will be affecting the nervous system, and next is that will be affecting the cardiovascular system or the blood. So the first type of venom is rich in neurotoxins and act essentially on the nervous system. That is neurotoxic. They are actually examples: the cobra venom and the krait venom. So next is actually the venom is rich in cytolysine and hemorrhagin. That is actually hemotoxic, or they will be depending, or they will be putting their action completely into cardiovascular system. That is viper venom. That is hemotoxic, toxic for blood. Next is the cobra venom. That is toxic for neurotoxic, nervous system. So these are actually the bitings in a cattle. So we can easily identify the venomous snake or non-venomous snake based on their triangle shaped head. So venomous snakes will be having, you can see, triangle shaped head. But non-venomous, they will be having rounded head. And seeing their pupil, elliptical pupil will be a feature of this venomous snakes. And in case of rounded pupil, that is mainly in non-venomous snake. And we can also see their bite marks. Mainly the venomous will be having two bite marks, but in case of non-venomous, they will be having two and two very adjacently. So next is moving to the symptoms. The bite of cobra or krait is followed by severe pain and local swelling will be there due to the toxins present in the blood. So necrosis of tissues around the wound starts in about 48 hours. That is, after 2 minutes, the wound will become necrotized due to the excess autolysins and hemolysins or tissue lysin toxins present in the venom. So there is will be like muscular weakness will be there, inability to swallow because our completely hemostasis will be made into an imbalanced condition by the toxin. So later on there will be respiratory paralysis due to the depressant action on the respiratory center. Allergic reactions like urticaria may be marked. The hemolysis is insignificant in case of cobra bite. Hemolysis is more in case of the viper bite because the hemotoxins are mainly present in the viper venom. So the venom of viper mainly acts on the cardiovascular or hemovascular system. So there is intravascular coagulation of blood, extravasations due to dilatation of capillaries and also hemolysis. Convulsions also may occur due to hemorrhage in the cerebral cortex. Death will be actually due to the circulatory failure, pulmonary embolism or asphyxia. Locally, there will be pain, swelling, thrombosis, and necrosis. At postmortem, hemorrhagic elements and infarctions and blood in serous cavity are noticed mainly. So, the management, how to manage the snake bites. So, snake venom invades the system mostly through the lymphatic channels and not so much through the bloodstream. So, the old methods like use of tourniquet, incision at site, and aspiration are not actually recommended now, but still people are using those things. So, the wound is cleaned and washed with potassium permanganate solution and treated on general principles as detailed below. So whenever we are getting a case of snake bite, first of all, we should actually clean the wound and wash with potassium permanganate solution And then we should go for general principles of snake bite management. So first of all, the antivenin is the best method that is administered very slowly mixed with saline as a drip. So then since anaphylactic reactions are very common with the antivenin, it is advisable to keep simultaneously another intravenous needle and apparatus ready in sit for adrenaline administration. Whenever anaphylaxis is coming, we should remove the antivenin and we should go for adrenaline administration. And soon after the anaphylaxis is controlled, antivenom should be re-administered. A number of antivenin vials should be required to case to continue treatment and snakebite subsiding. So make sure that you have the drugs adrenaline, that is to prevent the anaphylaxis, and antivenin, that is to combat against the venom. Next is tramadol, that is actually used as the opioid painkiller to relieve the pain. Next is tetanus toxoid. Since the venom will be having many organisms and the snake mouth is hosting many bacteria, we should actually go for tetanus toxoid. Since it is having many other bacteria, we should always move for antibiotic systemic treatment, that is parenteral treatment. And if at all there is allergic reactions and urticaria and all, we should go for diphenhydramine, that is actually antihistaminic drug. It also prevents serum sickness, since the serums are prepared from the horse serum and rabbit serum. It will have antigenic effect. So next is actually the dog bite. So there is a chance of contracting rabies if bitten by an infected dog. So dog should be kept under observation for 10 days to rule out the possibility of rabies. So hence some doctors recommended anti-rabies treatment in case of all dog bites. So the wound should be washed with plenty of soap water. It is unnecessary to cauterize with carbolic acid. This is actually a dog bite. So we are having the pet dogs and we are also giving food for stray dogs and all. So always you can help the animals, but be aware of rabies. So this is actually the treatment protocol, that is phenolized vaccine. This is a case of man and adult. This is the schedule and all: camel, elephant, cattle, pony, horses. This is duration of treatment. So next is the type of anti-rabic vaccines available and the source of supply. So next is scorpion sting. So scorpion sting, you will be noticing it sometimes. They are fatal. So there is severe pain, burning sensation and weakness immediately after sting. So within 4 to 6 hours, there is profuse sweating, gasping, and the patient is in almost shock-like state. So pulmonary edema will be developing and we will be vomiting blood. So treatment is actually symptomatic. So morphine atropine injection are given to relieve pain. Glucose saline injections to given counteract shocks. So scorpion bites are common. So moving to the insect bites, biting of insects like wasp, bees, certain flies, spider, etc. give rise to local inflammation and urticarial eruptions. So mainly treatment is actually washed with alkaline solution. If possible, the sting of insect left in the wound should be removed. Urticarial eruptions can be treated with corticosteroids and antihistaminics. So these are actually insect bites. You can see those spider bites. So not every spider bites will create a Spider-Man. So last one is the rat bites. That is actually, we have to be very careful because they can give rise to rat bite fever or intermittent fever in man. So there are many spirochetes that is spread through the bite of rats. So be careful. Rat bite fever has not been reported in animals, but it's reported in case of human beings. So be aware of that. Thank you.